Yep.
Okay, have a good one. All right, now let's talk about the big health care plan. House leaders, the conservative blue dog, so-called blue dog Democrats, they have come to a plan and something that they say that they could actually vote for. The deal clears the way for a possible vote in September when they get back from the break. Congressman Brian Bilbray just came out of a committee for government oversight, and he joins us on the telephone right now from Washington, D.C. to give us his opinion. Congressman, good morning.
Good morning, Dan.
Okay, let's talk about this latest plan. I know there's like 5 of them now, right?
Well, there is.
Yeah.
It's really a moving constellation.
Right.
And everybody's, as we talk, you don't know what's being printed up and what's being thrown out.
Yeah, so let's talk about a couple of the aspects of the so-called blue dog plan. First of all, what do you think about these blue dogs? Are they doing any good?
Well, I mean, they try to do good. And the fact is, I think the biggest issue is that there are districts that are moderate districts, and they're really hearing from their constituents that there's a lot of concern out there in these moderate districts, and they're really the people that ought to be, you know, those of us that represent mainstream districts ought to be listened to more, and we're the last ones anybody talks to usually, because usually it's extremes on both ends that drives the agenda. Yeah, you're right. They're making all the noise and they're getting all the attention, but the fact of the matter is most people are not on those extremes. Most people are in the middle of this deal. These guys are really kind of squeezed between pressure from Pelosi and Waxman to vote for a package that was designed from the left and then trying to go home to their moderate district. So they're trying to draw a line, and now they've got an agreement late last night. I was talking to them to try to get this thing changed out of a Medicare model so that doctors can get compensation that'll keep them in business. But they're really going to get, they're really getting hit from both sides, because you've got not only different people in the House that have got proposals to counter them at the last minute, but you also have the Senate has a totally different package. So this thing has really got a long way to go, and I think everybody, especially those on that are trying to push this package, realize that they really need to sit down and take a lot more time, that this is not something they're going to just ram through. I think they failed on that. The Blue Dogs stopped them at that, and I think that now it's try to provide something that has some substance. So they're going to have to write it down. That's the biggest problem with these verbal agreements. Well, let's hear it for the Blue Dogs. Let's talk about the small business aspect of this. This would exempt, because under one of the original plans, any business would be penalized if they don't provide insurance for their employees, an 8% penalty. But now they're exempting some small businesses that have a payroll of less than $500,000. I think a lot of people think that's a pretty good deal, or a good idea. Yeah, well, they're trying to go over that. You still have some real problems, and then you got the biggest problem we're not talking about is that 8% option for a lot of these bigger businesses that are providing benefits will drop benefits, because that 8% will be less than what they're paying now. So you'll have a lot of people dropping off. So this thing again is a wicked weave that they're involved with, and they're really trying to address that, because we know that half of the so-called taxpayers that in the category that was going to be taxed was small business, who you depend on to provide the jobs for the future, and here you are actually killing the people that you say that you want to help in the long run. And so I think they were looking at trying to get that thing moved, and they've got it moved to some degree. A lot of them still are not real happy with it, and I think a lot of them, rightfully so, are very suspicious with what the final proposal is going to be when it's finally written up and presented to them in September. Because remember, there's been a real notorious part of this Congress of presenting things at the last minute, late at night, and not allowing people to read it. I think that's a legitimate concern from both Democrats and Republicans. Can you say stimulus package? Yeah, stimulus package with a huge pay increases for AIG. Can you talk about the tax and trader bill where 300 pages wasn't even included in the document, was added in and wasn't even able to be read before they demanded writing it. So then this bill has $1 billion a page price tag. So a lot of people are concerned about that. We're really talking about some real money now. $1 billion a page. I like the way you put that. Holy cow! All right. So what are you doing today? Actually, we've got all kinds of items. We're just in our government oversight working on some items in the House floor. They're sort of scrambling, trying to fill in stuff because they don't have the health care package they were planning on trying to ram through. So hopefully we'll be able to get out of here and come home and be able to spend some time back in San Diego. So I'll see you. I'll see you Saturday out at Swami's. Okay.
Sounds good. Sounds good. Thanks a lot, Congressman.
Take care.
Okay. See you then.
Bye.